welcome to our Let's Talk Health live health Q&A. I'm Dr. Amanda Morelli, and I host this live health Q&A to answer any questions that you have. So last night I had some people join. I used to do these lives quite frequently, so now I'm back and having these live Q&As to answer your health questions. So last night we were chatting about some different health concerns. People had questions about diet, lifestyle, and exercise questions. So if you have any concerns that you were curious about, that you wanted a natural perspective on it, or just another insight, let me know what your questions are. You can ask me in the chat and I will be here to answer them for you. Okay. Let's see. So I'm just gonna keep the chat open. And I'll be here to answer any questions. So one thing I wanted to talk about today was vitamin D supplementation. So vitamin D, just from my experience of what I've seen, a lot of people are usually low in vitamin D levels. And when you get your vitamin D checked, you can get that easily done through a blood test. And you'll be able to see what your levels are, and then that way it's going to give you some help to know how you should properly dose your vitamin D levels. So if you go get that blood test done, you'll be able to see those results and then choose the type of dose that you should take. So the general recommended dose is about 2,500 units a day of vitamin D, but a lot of times that's not enough depending on what your levels are. So again, for like optimal levels, you want it to be around 50 ng per ml is the form of vitamin D you'll see on your blood work. So if you're anywhere lower than that, you may want to just reassess your levels and how much you're taking, and then increase your dose based on that. So vitamin D, it can be helpful for many things. One thing that we know a lot about vitamin D is for our bone health. So yes, vitamin D with calcium and vitamin K too can be very beneficial for bone health, but vitamin D is also really good for mood. So a lot of times if you have low levels of vitamin D, you might notice your mood is lower, especially in the winter time, because we do get vitamin D from the sun. So just keeping that in mind, maybe if you have a lower mood, or you have a tendency to feel down, get your vitamin D levels checked, make sure it's optimal, and take a supplement to help improve that. Vitamin D is also really good for cognitive health, hormone health, so many different benefits of vitamin D. So I'd highly suggest getting it checked out and see what your levels are at. Okay, so we have some people that are joining us. So hi everybody, welcome. I'm Dr. Amanda, a naturopathic doctor. I host the live Q&A to answer any health questions that you have. So thank you for the thumbs up and the likes. I appreciate that. And if you are new here, be sure to subscribe and join the community. And I do go on lives and I answer health questions. So let's see if there's any questions that I can answer. Does walking outside in the winter for 30 minutes enough for vitamin D, or is a supplement required? That is a good question. Walking outside for 30 minutes is a pretty good amount to get some good vitamin D exposure, but generally some supplementation is required, because other than the sun, it's hard to get vitamin D from food sources. There are some foods that are fortified with it, or it is usually in dairy products. But generally, even just a low dose supplement just to keep your levels at a minimum is required. So again, just double checking what your levels are, get a blood test done, and then you'll be able to see what your vitamin D levels are, so that way you know how much to take. And then the reason why it's important is because vitamin D, it is something called a fat-soluble vitamin. So what that means is it needs fat to be absorbed, and then it's also stored with fat. So you could actually overdose or take too much vitamin D because your body stores it really well. Whereas some of your B vitamins and vitamin C, it's harder to go overdose on those ones because they're water soluble. So your body actually just urinates the extra amount out. So with vitamin D, if you are supplementing with it, it's always good to get those levels checked, so that way you know where you're at, if you're not too low or not too high, and then you can take a proper dose of the supplement based on that. There actually are, it's pretty easy to calculate how much vitamin D you need. There are some websites where you can just Google vitamin D dose calculator, and it's going to ask you for a few things: your weight, what your current vitamin D levels are. So that's why you want to have a blood test. If you are taking any vitamin D, so then you just fill out those 3 things, and then, or what your desired amount is going to be, and then it will tell you how much you should take to get to those desired levels. So yeah, that's just some information about vitamin D. Vitamin D can also be very protective against cancer as well. So sometimes there's been some studies where people that have cancer can have low levels of vitamin D. Not saying that vitamin D deficiency causes cancer, it's just something that can be implicated in it. So a lot of times by taking vitamin D levels, it can help your immune system, which is great for helping to prevent cancer as well. Okay, so we have some new people that are joining us. So hi everybody, welcome. I'm Dr. Amanda, I'm a naturopathic doctor. Thank you for joining. If you are new here, be sure to subscribe and join our health community. I do a live Q&A where I answer any health questions. So feel free to drop them in the chat, and thank you for the likes. I do appreciate that. It does help get the video noticed across the YouTube channel, so more people can come on here and ask more questions. Okay, so we were just chatting a little bit about vitamin D. I'm curious to know if anybody has ever had their vitamin D levels checked. I actually just had mine checked not too long ago, and I thought maybe I would be low in it just because I was feeling quite tired. But my levels were okay. They were at a decent range, so that just helped me know, how much I should take, just to make sure I'm taking a proper dose. So if you haven't checked your levels, it'd be a good thing to double check. And simple question, just ask your doctor if you can have your vitamin D levels checked, and then you'll see what your levels are. If you're a lot of times, if you're within the range, you're going to be told, yeah, you're okay, you're within that range, but you want to be within the optimal part of that range. So on the lower end of the range, it's going to be around a 30. On the upper end of range is 100. This is what we use in the States as our range of vitamin D. So an optimal is going to be around a 50-60 ng per ml. If you're doing it from Canada, it's N moles per liter, and then that one around like 120, 150 is a good indicator for vitamin D levels. So that's just something to keep in mind when you're checking it, what your levels are, and then just knowing that, within that range where you're at. Okay. Let's see if there's any other questions. Okay. Do you have any recommendations of where to get blood work done if you are paying out of pocket? Yeah, that's a good question. So when I do see patients, a lot of patients have to pay out of pocket. So we go through something called Ulta Labs. So there's that. There's also Rupa Health. You can get blood work done through there. And then recently I've been seeing a lot about Function Health. I believe it was started by Dr. Mark Hyman. He's like a functional medicine doctor. But I think I don't know if they have individual tests, but I do see that they have like a package where you can purchase a big package of tests, and then that's done through out of pocket. But yeah, if you are in California and you're interested in that, you can always send me a message on Instagram, and I can give you some more information about that. But if you are anywhere else in the States or in Canada, generally you can just go through something like Rupa Health, and they have out-of-pocket options. Yeah, great question. Okay, let's see what else I wanted to chat about today. We were talking about vitamin D. Another popular, or another, I guess, vitamin that's known a lot is vitamin B12. So vitamin B12, we get this through diet, and main sources of vitamin B12 are going to be your animal-based sources. So if you are a vegan or vegetarian, just know that it's harder to get it through the diet. There are some things that can be fortified with it, but generally you might have to take a supplement. So vitamin B12 is really important for our red blood cell production and our hemoglobin. And then those are two things that are important for energy, because hemoglobin is going to it binds to oxygen and transports it throughout your whole body. So if you're feeling tired, if you're feeling weak, if you exercise and you just feel like really burnt out after, maybe get your vitamin B12 levels checked and see if those that dose of vitamin B12 is good and in optimal range. Another thing is if you have a lot of gastrointestinal health concerns, so maybe you have Crohn's or colitis, even things like IBS or other issues like issues with your gallbladder or your liver, you might not be absorbing your vitamin B12 that well, because you need good stomach acid to absorb that. And then if you're not absorbing your B12 well, then whatever you're getting through your diet is just not going to be beneficial. So in those cases, you might need to do B12 injections, and those are done through the muscle, either in your glute or your deltoid, and they can help increase your vitamin B12 levels. So that's another really good vitamin to get checked, and it's easy. You can just get it done on your blood work, similar to the vitamin D, and that way you know what your levels are at. Okay. Is vitamin K vital? Yeah, vitamin K is it is vital. It's actually really important in the clotting factors. So your body uses vitamin K to help with clotting, and that's important in your body. So it is important to have it. Now, generally, we don't really need to take vitamin K. A lot of times it's paired with the vitamin D because it helps with the absorption of it. But your body does produce its own vitamin K. They sometimes give infants a vitamin K shot, and that's because at infancy, your body just doesn't, your gut just doesn't produce it yet. So that's something just to keep in mind about vitamin K. Have you had any client cases of mold toxicity? And if you can, please share your experience. Yes, I have seen patients with mold toxicity. Great question. There are some tests that you can do to test for mold. They're usually urine tests. And then you can also buy kits to check your work environment or your home environment to see if there is mold present. Usually that's where people are getting it from. Let's say maybe you live in an old house or somewhere where there was a leak and then there's it wasn't properly ventilated and then there's mold buildup. So in cases of mold, they're tricky cases in the sense of it's not always clear-cut symptoms, because it can be things like fatigue and brain fog and joint pain or skin issues or gut issues or just so many different concerns. So it's not always something that it comes first to mind when we're going through a list of concerns, because generally we want to kind of rule out other concerns that might be happening that can have similar symptoms, unless somebody specifically says I think I've been exposed to mold. We might not jump to that as a first option, because it, like I said, it's pretty its symptoms overlap with other symptoms. So usually what we'll do is doing a test to see if there is any mold. If it is confirmed, then you want to just work on a couple of things. One would be supporting the immune system, so making sure that the liver is good and detoxifying well. High vitamin C can be really beneficial for that, so that can be even done through an IV or orally through supplements. Getting the gut microbiome working well, because that's where a lot of your immune system resides, in your gut microbiome. What else? You kind of just want to work on these foundation things, and then going and adding binders and stuff to help with detoxifying from the mold. One great supplement that's really helpful for any sort of, if we're doing detoxification support, if we're doing anti-aging support, hormone support, is glutathione. So glutathione is your body's major antioxidant, so your body does produce glutathione. It's from the liver, but if you take it in a supplement form, can be beneficial in some of these cases, like mold toxicity, or if you have a gut parasite or gut yeast overgrowth, or if you're having a lot of fatigue and energy concerns, or even hormones concerns where maybe your hormones are low. Um, Glutathione is a really good option. So I usually like recommending that one. It comes in a liquid form. Is usually the form that I like best for absorption. There's glutathione, and you could actually also do that through IV as well. So yeah, great question. Okay, so we've had some more people that are joining us, and we're getting some great questions in the chat. So thank you for the questions. Thank you for the likes. I really appreciate that. It does help with getting my video noticed across the YouTube algorithm. And if you are new here, I'm Dr. Amanda. I'm a naturopathic doctor, and I host these live Q&As just to answer any health questions that you might have. So feel free to drop your questions in the chat box. I'm here to answer any questions that you have. Of course, this is all educational information. It's not any medical advice. So I don't know your medical history. I don't know, supplements, medications that you're on. So always double check anything with your own provider before starting anything. Is glutathione expensive? How long do you take it for? I'd say it's a pricier supplement. So probably like a mid tier, whereas something like, for example, iron, B12, those are pretty like affordable, cheaper supplements. So I'd say it's one of the more expensive ones. In terms of how long do you take it for, I usually recommend doing something like that for 3 months. That's usually a good amount of time. And then you'd want to take a break from it. You shouldn't really have to be taking it more than 3 months at a time. It's not something that you would really take long term either. For example, something like vitamin D, like we talked about, that is like a long-term supplement that you could take every day, whereas something like glutathione, it'd just be in those specific cases of, let's say, mold toxicity we mentioned, or if you're having any parasite or yeast overgrowth and you need an extra additional boost to support your detoxification process. So, yeah, great question. Okay, thank you so much, everyone, for the questions. Are there any foods that have glutathione? Not that I know of, off the top of my head. It's kind of, it's not really something that you get from food. It's something that your like liver, kind of like an enzyme in a sense that your liver would produce, if you think of it that way. Yeah. Okay, so I talked about B12, vitamin D. Those were two pretty popular vitamins. What else can we? I kind of mentioned iron, so why don't we talk a little bit about iron and if iron is needed and how you get iron. So iron, similar to B12, is great for energy, for your red blood cells, for helping with muscles and recovery. But this is another one that you want to get checked as well, because you can have too much iron, and then you can have something called iron overload. And if you have too much iron, then that can also cause issues. So it can cause you to be feeling like having headaches, or feeling muscle aches, feeling just a little unwell, and that would be signs of too much iron. Whereas if you are iron deficient, you would feel pretty fatigued. You can get things like heart palpitations. You can have, what's the other one? Shortness of breath. So these are signs of iron deficiency. Now, generally, males aren't really iron deficient. It's more females, because females have their periods and then they lose blood every month and they lose iron that way. Usually if I see a male that like is really deficient in iron, then it's something that is actually a concern, like more of a red flag. Like, how are they losing blood, and why is their iron low? So you would look into things like, are they potentially having a bleed internally, like a gastrointestinal bleed? Maybe in things like colitis, where you have diarrhea and like blood and bleeding. So usually for males, If iron is low, we're trying to look at, you know, what's going on, because it's not a common thing. For females, I see a ton of females that have low iron, unfortunately, and that's usually because maybe they're bleeding too much in their menstrual cycle, or they're just not absorbing their iron well enough, so they can't keep those levels high enough. So checking your iron through blood work, so that way you know if it's too low or too high, can be beneficial. And then through food, you get iron through food, like meat is going to be like your main source of iron, leafy greens. So even if you're not deficient in iron, still having like sources of iron through your diet is beneficial. Does exercise increase iron? So I wouldn't say exercise increases iron, but exercise can help with the distribution of your blood through your body, so the circulation, and when your blood is moving through your body and it's not just sticking around and being stagnant, then it's going to help get iron to your muscles and to all those cells, so your cells can utilize it better. So I'd say indirectly it can help circulate iron. So yeah, exercise is really good, really important to try to get some daily exercise. I know it can be hard. Even for myself, I find that it's hard to get exercise in. But yeah, I have a great husband that motivates me. So if you find somebody that's helpful for motivating you, maybe you have a workout buddy or a friend or a family member, somebody that can help get you going and motivate you to go exercise, whatever that exercise looks like, and can be very beneficial for so many different conditions. Okay, absolutely, yes, I agree. Okay, so thank you everybody for joining so far. I appreciate those likes. I appreciate the thumbs up. It does really help get this video noticed across YouTube. If you are new here and you haven't joined my health community, go click on my profile. It's called Let's Talk Health. Feel free to watch any of my previous videos, but I do host these live Q&As where I answer your health questions. And I'm here to, answer anything that you might have in regards to supplements, diet, lifestyle, whatever, you're curious about knowing about. I am a naturopathic doctor, so I try to give a holistic approach. Okay. So let's see if there's any other questions, and I will hang around for a little bit longer to answer any questions you might have. So we talked about vitamin D, we talked about vitamin B12, iron. What else is another important vitamin or mineral? Zinc. Zinc is another really good mineral. Zinc we can get through pumpkin seeds. We can get through like nuts and seeds, have a lot of zinc in them. Oysters are actually a really high source of zinc if you eat oysters, seafood. So zinc is great for the immune system. Zinc is good for helping out with healthy testosterone and estrogen levels. Zinc can help support your mental health as well, and mental clarity. So zinc is a really good mineral. Generally, you usually get enough zinc through the diet, but sometimes if you have certain conditions, skin, that was another one, acne. So like if you have acne or skin conditions, you might be lacking in zinc, and extra zinc can help out with that. Or if you have issues with your testosterone levels, zinc can be beneficial as well. So that's another great mineral to look into. Okay, there's a question. Is popcorn a healthy snack? So I'd say it's a healthier snack because it's really just coming from corn that's getting popped. If you have popcorn, having it, the whole kernels versus the one that's in those microwavable bags is going to be a better option. So if you can buy those whole kernels and like either pop it in a pot and then add butter on your own, it's going to have more of like whole ingredients versus the ones that come in those bags, and they put probably a lot of oils and chemicals and preservatives to keep it fresh. So in that sense, if you're doing like whole kernel popcorn with butter and salt, yeah, that's a healthier snack. It's if you're watching your calories, it's a low calorie snack. Yeah, it's generally a pretty good snack as compared to something like chocolate bars or candies that are going to be loaded with sugar. And it does have some fiber in there too because it is corn. So yeah, that's a good question. But if anybody else is curious about certain snacks or healthy foods, feel free to ask me. I think I like I like both salty and sweet snacks. I don't know. I'm curious to know if you guys like salty or sweet snacks and what your go-to are. But I would say if I like something sweet, it's usually going to be a cookies. If I like something that's salty, like nuts or crackers, cheese, that kind of thing. Chips are okay too. Not always my go-to snack, but yeah. Okay, if anybody's just joining us, hi and welcome. I'm Dr. Amanda, naturopathic doctor. I host this live Q&A to answer any health questions that you might have. So feel free to drop in and ask me any questions that you have. If you are new here, I host these live Q&As, so be sure to subscribe, join the community so you get notified when I go live. And then thank you for the likes. I do appreciate the likes on the video. What about Nick's protein bars? Why don't I pull up the ingredient list on those? Nick's protein bars. See, the thing with protein bars is it's hard to find something that is like really, really good, really clean, low in sugar, high in protein, low in carbs. I'm curious if anybody has any protein bars that they like. Drop them in the chat because I find that it's hard to get like the most perfect protein bar. And then of course the ones like if you're doing it without, they're going to be sugar free, then you're adding in those like sugar, erythritol usually, or stevia, which are not always the greatest of consuming like in high amounts. So with protein bars, I'd say they're okay if it's something that you want, let's say as a snack, maybe once in a while. It's going to be a better option than having a chocolate bar, that's for sure. Okay, so the Nick's protein bars, they have collagen in them. They have some whey protein, some different types, isolate and concentrate. So that's fine. Then they use vegetable glycerin, so that's the sweetening there. So it doesn't count as sugar. They use some corn fiber, cocoa butter, water, erythritol, whole milk powder, some vegetable oils, some unsweetened chocolate. They use butter, so it's not dairy free then if anybody's concerned about that. Skim milk powder, and then some sorbitol. So generally it's like it's okay. It's got 15 grams of protein in there, 19 grams of carbs, but then if you minus the 5 grams of fiber, you're going to be left with 14 grams net carbs, and then 2 grams of sugar. So not too bad in terms of those options. Yeah, I'd say most protein bars are kind of around that. There are ones that they what's it called, like the RX bar, and they use egg white protein, and it's like more of a Whole Foods bar because it's like egg white powder and then dates and nuts. But I tried it once, I didn't like it. I just found that it was like really sticky and just not the greatest. But if you want something that's more of like a Whole Foods protein bar, that's an option. You could also make your own protein bars. Again, like if we're going to try to do that, you're going to have probably like a cleaner option of a protein bar, but it's going to take you time to do that. So I wouldn't say use a protein bar as like a meal every day, but if you need it as a healthier alternative, a snack, something that's high in protein, it's a good option. All right, well, thank you so much for the questions. I'm going to hang around for a couple more minutes, and if anybody has any other health questions, just drop them in the chat. If you are just hopping on and you just joined us, I'm Dr. Amanda. I'm a naturopathic doctor. I host these live health Q&As to answer any health questions that you have. So if you have a question, maybe you don't have a question today and you're just joining the chat, but next time I go live, just drop your question in the chat box. I will answer it. If it's anything about, supplements, we chatted about blood work. We were chatting about supplements, diet, mold, toxicity, gut health concerns. So any questions like that, you can ask me in the chat. Be sure to subscribe and turn on your notifications so that way you get notified when I go live, because I will go live at different times every day. Okay, there's one more question. Let's see. Have you ever seen the episode of Simpsons where Homer put a pot of spaghetti into a churner and then turned it into spaghetti bar and then No, I haven't. I don't know, maybe I have, but I can't remember, but that sounds pretty funny. All right, well, I appreciate all the comments and all the likes on the video. I will see you all next time, okay? So I hope everybody has a great night, and see you next time. Bye.